One of the most common problems we have when a patient comes into our office is that their eyes burn. And I've seen patients come in and they have a bag of drops. They've been to 5 or 6 doctors. They're giving them all different types of drops, antibiotics, steroids, things for allergies, and their eye still burns. And usually it's from creams being put on the eye, especially wrinkle creams. Wrinkle creams go right through the eyelid. So anything you put on the eyelid is going to go right through, and it's going to cause your eye to burn. So you have to be very careful if you're going to use makeup. A lot of times we'll see people that are wearing makeups that are oil-based. It goes in the eye. You see these little balls of makeup, and it actually could cause little scratches of the eye and cause the eye to be irritated. We always recommend water-based makeup, because if it gets in the eye, it melts. If you get some kind of chemical in your eye, if it's alkali, it's much worse than if it's acid. So if you get some kind of chemical in your eye, have somebody call poison control while you're rinsing the eye. Obviously the best is to rinse it with saline or contact lens solution, but if you don't have that, you have to use water.
Well, pink eye is an inflammation, a redness of the white of the eye. It's known in our circles by a term called conjunctivitis, because the conjunctiva is the covering over the white of the eye.
Think of pink eye like a fever. There are many different causes of fevers, hundreds. Same thing with pink eye. There are hundreds of different causes of pink eye, but we put it into 3 main categories: bacterial, viral, and allergic. If it's allergic, it's itching, and that's not contagious. But if it's bacterial or viral, it's very contagious, especially the viral one.
It can be very contagious. So it's important to see your optometrist as soon as you develop a red eye to determine what the cause is. If it's allergy, the treatment is, number one, to get rid of what's causing the allergy. So to try to determine what's causing the allergy is essential. Secondly, you want to treat it normally with drops. If it's bacterial, which oftentimes will exacerbate as crustiness around the lashes and lids, especially in the morning when you wake up, well, then we treat it with an antibiotic drop. And if it's viral, that's a little more difficult to contain, but there are antiviral drops, just depending on how severe it is. It's contagious because it can spread very easily. So if you wipe your eye and you shake my hand and I touch my eye, there's a very, very good chance that I'm going to contract the conjunctivitis or the red eye. Washing your hands using a towel, somebody else in the family uses that same towel, very, very good chance that you're going to pick it up as well.
So it's very important that you're always washing your hands and that you're keeping your hands clean if you're around somebody that may have a pink eye, or if you're in a public place, because sometimes it takes 8 days for the pink eye to come out. You could be sitting somewhere where somebody could have had it, and then you touch your eye, and then you get pink eye, and the doctor will say, have you been around somebody with a red eye? And you say no. That's because you could be incubating it, but it won't come out for 8 days. So make sure you're in a public place, you're always washing your hands, and you're keeping your hands clean.
It's essential to see your optometrist if you have a red eye, because it may not be conjunctivitis. There are a gamut of other causes of red eye. It could be an inflammation of the iris, the colored part of the eye. And if it is an inflammation of the iris, that could be very serious. If it goes untreated for a period of time, it could cause an eye disease called glaucoma. It could also cause permanent loss of vision, because the inflammation from an iritis is more serious and more difficult to control. Another cause, for example, is an acute glaucoma attack. If your eye pressure raises up suddenly out of nowhere, you can develop a very red engorged eye around your iris, and your eye pressure can be dangerously high, which seals off oxygen to your optic nerve. If that happens, you can suddenly lose all or most of your vision, especially in the periphery. It could be a hemorrhage or a broken blood vessel. That could look really nasty. It could look like a dangerous situation, but if it's a broken blood vessel, the treatment is no treatment. Just reassuring you that there's nothing to be done, but just let time heal it. If somebody develops these broken blood vessels more than once, though, I will recommend blood work, because it could be a sign, if you're on blood thinners or you're taking an aspirin every day, that your blood is getting too thin. So it's very important. I can't stress enough. If a person has a red eye, they should not self-treat. They should go right to their optometrist so that we can figure out the cause and make sure that we treat you properly. Well, if you're wearing contact lenses, especially reusable soft contact lenses, ones that you're cleaning every day, there are more risk factors involved. If you develop conjunctivitis and you're a full-time contact lens wearer, you're more vulnerable to a worse outcome because, again, your eye is not getting as much oxygen through the lens. The lens is picking up all these foreign organisms that are in contact with your eye from the red eye. Throw away your contact lenses that you've been wearing. You must throw away any solutions that you've been using. So it's imperative that you cease contact lens wear, go straight to your optometrist so that we can guide you and treat you properly, and throw away any solutions that you've been using along with your contact lenses that you've been using. Giant cell arteritis can be very serious because it's very painful. It occurs primarily in the elderly. 70 or over is the most typical profile of a patient who will suffer from giant cell arteritis, and their symptoms are typically very, very severe pain, typically in the temple area. And the treatment for that is systemic steroids. So we've got to get the patient to a medical doctor who can treat the patient with high-dose systemic steroids as soon as possible. And it's caused by inflammation of the lining inside the artery. And if the lining inside the artery becomes inflamed, what can happen if it's not treated quickly is it can constrict the blood flow through the artery to the ophthalmic artery, which nourishes the eye. And what can happen if it's not treated quickly is you can lose your total vision in one eye. That's very serious because your vision is gone permanently if that was to happen. Other symptoms can be jaw pain, scalp tenderness. You can have blurry vision. Blurry vision can be one of the symptoms of this. Giant cell arteritis occurs in about 1 of every 15,000 people over 70 in this country on an annual basis. So although it's not extremely common, it's very severe, so it's important to be addressed and to get treated immediately. If you take the steroids, you can eradicate the issue and a person can walk away with no irreversible damage. Corneal arcus is very common. It's a whitish, grayish ring around the edge of the colored part of the eye. It's actually on the cornea, which is the covering over the colored part of the eye. It's quite common over the age of 40. Oftentimes goes all the way around 360 degrees around the colored part of your eye, although it starts out normally in the lower and the upper parts. If we see corneal arcus in somebody over 40, we're not distressed, but it can represent a disruption in the metabolism of fats because what is in that ring are fatty deposits, lipids, triglycerides, cholesterol. And as I said, it represents usually some type of a disruption in the metabolism of the lipids, but studies have been conflicting over the years, but the most current studies seem to show that it doesn't present any systemic health-related risk for people over 40. If somebody develops this arcus under the age of 40, that is definitely indicative of a possible risk factor for later on having heart disease, and those patients need to have blood work because they need to determine if there's anything elevated in their lipid profile. Corneal arcus is not reversible. Once you have it forever. Many patients present with a thickened yellowish deposit on the white of the eye, more typically towards your nose than towards your ear. And it's very common, more so in people over the age of 30, and it's most commonly caused by exposure to ultraviolet light from the sun. Also, dust and wind exposure can cause it. It's normally not irritated, it's just a cosmetic issue for most patients, and it is treated generally just by wearing UV protection. Sunglasses can help slow down the formation of this. This yellow thickened area, which is on the white of your eye, is only something to be concerned about if it starts to grow onto the colored part of the eye, because it can possibly eventually cause disruption in vision if it continues to grow onto the colored part of the eye. If it stays on the white of the eye, it generally isn't something to be concerned about other than the cosmetic effect. It can occasionally get dry and inflamed, and if it does bother a person and if it does become dry and red or inflamed, lubricating drops and or decongestant drops normally will take care of that within a few days.
Thank you for watching Open Your Eyes. Be sure to tune in for more informative episodes.